A very good afternoon, everyone. Today we are going to know few basics and few things about obstructive sleep apnea. So it's a most common lifestyle associated disorder which we are seeing now day to day in our day-to-day life, and unfortunately, it is getting unnoticed. The problem is people don't know that we have a component or we have a disease called obstructive sleep apnea. We just think it's a simple snoring. Yes, snoring can be simple as well as sometimes it can be very much complicated, and it depicts or it shows your ill health or unhealthiness. So, what is obstructive sleep apnea? What exactly happens in a OSA patient? So, we all know that we take in air. The process of breathing in and breathing out. So, we do it daily even while we are sleeping. Whenever we breathe in, because of negative pressure in the lungs, air will be sucked in from the outside atmosphere into our lungs. So this is a normal physiology. Whenever a person sleeps, or either in alcohol intoxication or because of any conditions which leads to any conditions in the brain or CNS issues or stroke, where we see the loss of tonicity or improper impulses being carried from the brain to the muscles. When we see these kind of things, the airways, the passages through which the air is being taken in become smaller, and they close, so that whenever we are trying to take in the air, it won't go in. This is what happened in apneas. So apnea per se, the definition is a minimum of 10 seconds cessation of breath. That means air won't be going inside our lungs. When we see more than 90% decrease in airflow into our lungs for a minimum of 10 seconds, we call it as an apnea episode. If it is not 10 seconds, then we call it as hypopnea episodes. So whenever a person breathes, we have apneas and hypopneas. We include both, including both apneas and hypopneas, we get an apnea hypopnea index. So a patient with an apnea hypopnea index of less than 5 is normal. 5 to 50 per hour. Remember, this is per hour. We call it as mild. 15 to 30 is moderate, more than 30 is severe. Mild, a patient who comes under mild category, then we can say that nothing to be done. Or patient with mild category with symptoms, which I'm going to explain in few minutes. So with symptoms, then we say that he has to be treated or his condition has to be addressed. With patient with moderate or severe apnea hypopnea index, we need to address them at any cost. So I just put a picture over here. I think you all can have a look. What exactly happens when we sleep? This is how air goes from the nose into the nostrils, into the nasopharynx, and then into the lungs. And even from the mouth, when your mouth is open, this is how the air goes from your mouth. This is the tongue. From here, it goes into the oropharynx, and then it goes into your lungs. So anywhere obstruction to these airways causes obstructive sleep apnea. So see here, I think you can see the picture over here. In case of children who have adenoids, so in them the air won't pass through those adenoids when they're hypertrophied adenoids. In case of adults, they can have a larger tongue or any other cause which causes blockage of this airways. This leads to obstructive sleep apneas. So apneas are two types. One is obstructive sleep apnea. The other is central apneas. In central apneas, we per se don't have the signal coming from the brain. Whereas in case of obstructive sleep apnea, from the brain, it will come to our muscles, but the air passage will be affected. Central apneas generally we see mostly in kind of in case of neurological conditions or strokes, etc. So what happens? why is it necessary to detect these obstructive sleep apnea patterns? So, person whoever snores, they should remember snoring. I think vaguely we can say a good snore and bad snore. There's no terminology really like that, but just for our understanding. So, patient who snores and who does not have obstructive sleep apnea, then no need to worry. Patient who snores and if they have obstructive sleep apnea, yes, then we have to address it based on their AHA scores. So, how can we know whether they have obstructive sleep apnea or not? So we have to do a sleep study. We have three types of sleep studies: level 1, level 2, and level 3. In case of level 1 sleep studies, it will be a in-house study where the patient or the person has to go to the hospital. He has to sleep over there. Uh, Leads will be attached to him in the head, in the eyes, the chin, abdominal leads, and thoracic leads and abdominal leads, and nasal canister will be attached. It will be a bit to look at it. It will be a bit scary, but nothing to worry. So, and then you will be monitored in house with a CC camera, with a night camera placed in the room, and you'll be allowed to sleep happily. So, all your movements in the night, if there are any movements in the leg, if there are any movements in the body, those all also will be monitored. So, we call it as level 1 sleep study, which will be done under supervision. Coming to level 2 sleep studies, in level 2 sleep study, we can get this test at home itself with the same leads. We'll be placing neurological EEG leads, we'll be placing ocular leads, we'll be placing mental leads, we'll be placing nasal canister for airflow. We'll be having a device which measures the snore. We'll have thoracic leads, we'll have abdominal leads, we have the EEG leads which will be attached to a small machine and will be connected on the towards your side. So you can sleep happily in your home. You can turn towards any side. The person makes sure that no lead should come off from your body. So, other than in-house examination, all the other leads which are there in the most of the leads which are there in the level 1 study will be included in level 2 study. Whereas level 3 study, we have only 4 leads. I think either we have thoracoabdominal leads with only nasal canister, etc. will be there. So, ideally, level 1 study is preferred for diagnosing apneas or in case of this OSS. But if it is simple obstructive sleep apnea without any restless leg movements or without any sleep disorders, we can go for level 2 sleep study. So it gives us comfort. You can get it done at your own house. You can sleep in your own regular settings, and then you can come back with the report. So what exactly, when we have to get this test done? So in the past 1 week, or what is your normal sleeping routine, you have to get the test done in the same time. For suppose if the person is on night duties for the past 3 months or 6 months, then when you should get this test done? If he sleeps in the morning, yes, you have to get this test done in the morning. Generally, but we all sleep in the night, so you can get this test done in the night. There are particular rules. You should not drink coffee, you should be away from the nicotine, and you should not smoke, so that you will have a better sleep, so that we can have better studies, better sleep study. So that is how we do sleep study. Once the report comes, we will come to know whether the patient is having first thing, how many apnea hypopnea episodes are there. Second thing, what is his AHA index. Third thing is whether obstructive apneas are there or more of central apneas or mixed. In case of mixed apneas, the patient from brain itself, sometimes it won't give the stimulus for us to breathe, as well as when the stimulus is there, it will the oxygen or the air won't go inside. So we see both central apneas and obstructive apneas in case of a mixed apneas. So we will be knowing whether the patient is having a obstructive apneas, central apneas, or mixed apneas. We also will know how much amount of oxygen levels desaturation is seen. We take it as significant when there is more than 4% for apnea, and it changes. Sometimes it is being said 3%. Sometimes it's more than 4% drop in SpO2 levels. We take it as significant. So how much amount of oxygen level drop has been, is seen, is also noted. So maximum amount of oxygen drop will also be seen in our sleep study, whether it's around 50, 60, 70, or 80. And for how much amount of time the oxygen level drop is seen also will be recorded in this study. So you'll have a clear cut picture. And then how is your sleep cycle also will be recorded in the study. So generally we have NREM stage and REM stage. In NREM stage, we'll have N1, N2, N3, and then REM. It's a cycle. The cycle consists of 45 minutes. So for every 45 minutes, the cycle will be repeated. So we should have minimum of 7 to 8 of these cycles, so that we will have a complete sleep. Always we should remember minimum 4 hours sleep is required for us to say that we did a proper sleep study. So in this 45 minutes of cycle, we see how much amount of time you are there in N1 stage or N2 stage or N3 stage of your NREM sleep, and how much amount of your REM sleep is there. So every person should have a proportionate of all these stages accordingly with the age and with the time and with the duration of the sleep should be there, which we can come to know in your sleep study. So it will be documented completely. Everything will be same. So basing on this, we see whether you're a light sleeper, whether you're a deep sleeper, or whether you're having any difficulty in transition from one phase of your sleep to another phase, or where should we intervene. These things we can come to an idea basing on your sleep study. So after sleep study, if we come to know that we have some problem or we have an OSA, especially obstructive sleep apnea, then what next to be done? Then we'll be doing a titration study. That is, we'll put you on CPAP, and through which some pressure will be given to you. So as I said to you in the beginning, what happens in case of obstructive sleep apnea? Because of the negative pressure, air generally goes inside our lungs. So when we try to inhale because of negative pressure, the airways gets collapsed and air won't be entering into the lungs. So what does this CPAP do? This CPAP just gives us, this CPAP just gives us a partial pressure so that the airway collapse will be prevented. So this is the amount of pressure which the CPAP gives. This will be determined basing on your sleep titration study. We generally start with 6 centimeters of water and we gradually titrate it in 2 centimeters in the increasing trend, and see which is the best pressure at which you will get rid of this obstructive sleep apneas. So whether you've been needing of 6 centimeters, 8 centimeters, 10, 12, 14, 16, 15, whatever is your requirement, that we will be documenting it. So again, this can be done, this has to be done in an in-house procedure. The proper sleep in a proper sleep lab, you'll be we'll put a mask for you where these pressures will be adjusted by us from the outside, and the leads will be connected so that we'll be seeing it. We'll be watching it, how much pressure your body or you need. So with this, the target apnea hypopnea index should be less than 5. If it is less than 10 also, that's fine. In patients who have very, very severe obstructive, AHI index, or in whom the pressures are more than 20 centimeters, then we may need to prescribe you some on BiPAPs. In BiPAP, what exactly happens is we can give pressures up to 25 centimeters, and with the inspiration and expiration, we can titrate the pressure. While you're inspiring, we can give you high pressures, and expiring, we can reduce the pressure. We have a IPAP, inspiratory posture pressure, and we have a EPAP, expiratory posture airway pressure. So with this, a bit of comfort can be given. So what problems generally patients see with this OSA is you need to put a both face and nose mask. I know it will be very difficult keeping some mask tied to you with tightly, and sometimes there might be some leaks from this side or from this side, and the air will be gushing into your eyes. Yes, these things will be there, but trust us, once you got habituated or once you get adjusted to these devices, then you yourself will say, sir, we don't want to leave. We were very much happy after seeing the sleep quality which you get with this mask. Regarding this mask, we have many masks. We have a full face mask, we have simple nasal mask, we have a nasal mask which is like a pillow without causing any crease over here. We have nasal pillows. So multiple options are there. We have a mask with silicone. We have gel-based masks. So initially, we would advise you to either go with a face and full face mask, that is nose and mouth mask, or with a nose nasal masks. Why? Because comfort we can go to later. Once we put it, we understand the essence of this. Then you will continue using these masks. Then we can go for luxury or comfort. So CPAP, we come with the device comes with humidifiers, and it's many companies are there. I mean, two of the important companies are there, and which many specifications and other things are there, which you can select basing on your needs. So one thing is, if there is a humidifier, that is generally better, because yeah, whatever this is, you have to use it for longer time, and it prevents crusting and it prevents nasal drying or oral drying. So this is how to use this device. So who should get tested? I know I should have said this thing prior, but yeah, whom should you suspect? And what happens if you don't address this obstructive sleep apnea? Person who generally snores a lot, and when the spouse or the person who sleep besides him says that in between his sleeps, he stops taking his breath for 5 seconds or 10 seconds or 15 seconds, and then suddenly with a large a sound or with a bang, he or she starts taking and breathing. So we call it as observed apneas. So in such kind of persons, in a person who feels not fresh whenever he gets up early in the morning, he just feels like to doze off a bit more or to have another nap. In those kinds of persons, in persons who have persistent blood pressure, whose BMI is high, more than 30 35, whose age is more than 50, and male gender has more risk factor. So all these persons are at risk of obstructive sleep apnea. So these persons should be tested. You should question yourself: how frequently do you sleep? Whether you take small naps in the morning, when you get tired or you get headache, and whether you're irritable more, you're having forgetfulness in more, and you are not able to concentrate. All these things may help us give a clue regarding your that may help us a cue that you should get evaluated for obstructive sleep apneas. So some people, they have more daytime sleepiness. They tend to sleep while sitting in the sofas, or while driving, or while sitting in the back seat in the car. They easily doze off while speaking. Some people are going to sleep. So these we see in cases where there are generally severe OSAs, and who are already affected profoundly because of this obstructive sleep apnea. It's not. Um, there are many manifestations of obstructive sleep apnea. If we don't treat obstructive sleep apnea people on time, or what will happen? It increases the risk of stroke by 7 times, or around 45%, and it even increases the risk of heart attacks or heart-related issues by around 5 to 6%, 5 to 6 times, not percent. Sorry. So it's better to act early to get yourself tested, rather than feel sorry once you get all these symptoms. People will have unaddressed obstructive sleep apnea, will have their increased cholesterol level. They can have uncontrolled blood pressures. They can have or nuanced blood pressure. Their sugars may not be under control, so they will have deranged immunity. So all these things we can see with obstructive sleep apneas. Studies have proven that even in obstructive sleep apnea, sudden cardiac arrest in the nights or sudden cardiac deaths in the nights have also been noted. Because what happens is, whenever we try to breathe in while we are sleeping, and whenever there's obstruction in your airways, the air won't go inside. That leads to hypoxia. That means your cells will be deprived of oxygen. It happens for a few seconds, and it happens with each and every breath or alternate breaths. So it will have a cumulative effect on your body. And moreover, this also leads to improper sleep. So if you don't get a proper sleep with proper with all the stages and proper proportionate of whatever stages which I said you, that should be seen in your sleep. If you don't have the thing, your body won't reboot, to be say, or it won't refresh when you get up in the morning. So antioxidants will be generated more and they won't be removed from your body. So it has n number of effects. So in n number of ways it causes a toll on your health. That is why obstructive sleep apnea should never be should be addressed, and it should not be taken lightly. The problem is most of the patients may not see an immediate effect or may not see an immediate difficulty, or they don't feel that sense of immediate requirement to go to a doctor because of this obstructive sleep apneas, because they don't feel that pain or that burden immediately at that point. But once when you start feeling these things and when you start the effects of this obstructive sleep apnea, then probably some amount of irreversible damage might have already been occurred, which is a loss for us. That's why address it early, address it properly. So what can we do? So if there is any surgical option, if there is any blocks in the airways, upper airways, or in the uvula or pharynx, so there is a surgical option which is available, which will be divided, which will be decided by your doctors whether it's going to help you or not. Losing weight is the best thing which has been proven till now that it will reverse your symptoms. So ideally, you have to start on your therapy with a CPAP or BiPAP, mostly CPAP, and then try to reduce your weight and see how much amount of apnea hypopnea index which is getting reduced. Basing on that, we have to take that call. So it will, if you leave it as such, it will have its effect on all the organs in your body, on your brain, on your kidneys, on your heart, on your lungs, and everywhere, on your immune system, everywhere. If you don't have a proper sleep and if you have OSA unaddressed, you will have effects on all the parts of your body. So yes, I think I have covered it in detail. Yes. Does sleep apnea cause excessive snoring? Yes. Sleep apnea causes excessive snoring. Sleep apneas we have, as I said to you, we have obstructive sleep apnea and central sleep apneas. So in obstructive sleep apneas, we do see excessive snoring. But all the people who snore may not have obstructive sleep apnea. That's why all the people who snore with the symptoms which I said to you, they should get themselves tested whether they have sleep apneas or not. Is snoring unhealthy? Snoring with obstructive sleep apnea is unhealthy. If it's a simple snoring without obstructive sleep apnea, no, it's not unhealthy. That's your body's, I mean, that's your breathing pattern. So sometimes when you have obstructive sleep apnea on the right side, or yeah, I'll get back to this question. We lie on the right side or we on the left side, then we see that the tongue won't fall back, or it won't close over here. So that people who sleep supine, that means like this. In those people, we do see apneas. So if they turn later, they won't have those apnea hypopnea episodes. Then we say, okay, try sleeping on one side and reduce your weight so that it will be helpful for you. Yeah, another question. Uh, Doctor, I snore, but I don't feel tired during the day. Does that mean that I don't have sleep apnea? You have to see all the other things also. So we have a questionnaire called Stop Bang, STOPBANG questionnaire. Okay. So snoring is one. S means snoring. T. T means tiredness. As you are saying, you don't feel tired during the day. So it's a negative for T. It's a positive for yes, snoring. O. Observed apneas. Ask your partner whether in the nights when you are sleeping, um, uh, did they ever notice that for 5 seconds or 10 seconds you're absolutely silent? Again, you are snoring with a huge sound or you started snoring. So if that's an S, then it is an observed apnea. And then P means your blood pressure. Are you an hypertensive? If it is an S, you put a one tick. And then bang, B means your BMI. If your BMI is more than equal to 35, then it's a plus one. A is age. If your age is more than 50, then it's a plus one. N is neck circumference. More than 17 inches, then it's a plus one. G is gender. If you are male, then it's a plus. So you just see after this S, T, O, P, B, A, and G. Stop bang. Out of these 8, less than 2, you're at no risk, 3 to 5, moderate risk, 5 to 8, high risk. For moderate high risk, you have to get yourself tested for sleep apneas. Snoring is different. If there can be n number of causes why you snore loudly. See, the simple thing is like, see, this is how our airways are. Okay, whenever there is some narrowing in the airways, we all know that some musical sounds we get. So whenever you sleep, whenever we are awake, our body tone will be maintained properly. Whenever we sleep, some amount of mild uh, decrease in tone and your tongue muscles and your other muscles in the pharynx, all these things will be there. Some amount of narrowing will be there. Okay, so even while you're sleeping or when you're awake, it's our duty to take breath. Whenever the breath goes in and comes out. So when it goes through a narrowed pipe, narrowed airways or narrowed tract, you snore. So it varies with person to person. In some obese people, they have narrowing over here, narrowing inside the airways, or they can fat accumulate over there that can cause snoring. In some people who booze, especially after taking alcohol, only then they need these snoring episodes, because even alcohol decreases tonicity, a bit of tonicity in our body, so the muscles will be more relaxed. So then even you see snoring. So multiple reasons will be there for snoring, which is again a patient based. So it depends on person to person, airways and tracts. Some people will have adenoids or tonsils enlarged, so that can cause a narrowing in the airways when they sleep. Because of that, they can be snoring. In some people, this mandible, this jaw, whatever it is there, it will be a bit backwards. So we call this rhythmography. Whenever we sleep, when you are breathing in, this backwardness will cause blockage of the airways, and even that causes snoring. If that is a thing which is a reason, we can simply correct it. The maxillofacial surgeons will just push your mandible a bit forward. So multiple reasons will be there to snore. Snoring during pregnancy is not harmful for the baby, but obstructive sleep, if you are having obstructive sleep apnea during pregnancy, yes, that can be harmful to the baby. So again, as I said, you stop bang questionnaire, you see you're falling in which category, either mild, moderate, severe. If you're in the mild, there's no need to worry. Moderate or severe, just get a sleep test. Doing a sleep test won't harm your baby. It has nothing to do. These are simple wires which should be connected to you for your body. They just measure how you are sleeping and how your brain waves are there in the sleep, how your eye movement is there. That's it. It's not going to harm your baby or anything. If you're in the stop band questionnaire, in the 1 to 2, nothing to worry. If you're moderate or severe, then just get a sleep test. And if you don't have OSA, then no need to worry. It won't harm your baby at all. Yes, it's a good question. Adenoids in kids is the most common cause of snoring in kids. They are, I can say, common generally by the age of 5 or maximum by the age of 8 years, adenoids will be gone. So till that age, with recurrent infections or upper respiratory infections, they can cause increased adenoids. So whenever the kids have adenoids, so we'll be giving them nasal spray or we try to treat them. And then we again reassess the kid after 2 weeks or 3 weeks. There will be criteria to see how much amount of adenoids are there and they're blocking it. Even after proper medical therapy, if those adenoids are not getting reduced and if they're consistently causing this discomfort and snoring, then they have to be removed in case of kids. Generally, Currently, what happens is proper medical therapy, these adenoid size will be decreased, and by the time at the max they reach the age of 8 years, adenoids will be gone. Yes, they are common in children. Does diet have anything to do with sleep apnea, snoring? If that's the case, then how to resolve this? Diet per se does not have anything to do with sleep apnea, snoring, but obesity because of your diet has everything to do with snoring and sleep apneas. So, if you're obese, try to change your diet and then reduce your weight basing on your BMI, at least reduce it by 10 to 15 kgs, and then it will give you wonderful results, and you will be your sleep apnea and snoring, everything will be gone. And yes, alcohol, I think either you take it in diet or I don't know, you take it for booze or whatever. If that is there, yes, avoid it, and it will really prevent sleep apnea and snoring. Otherwise, if you are not obese, then if the reason for your OSA is not obesity, then diet probably cause does not have much role to play in your sleep apnea or snoring. If sleep apnea is left untreated, it's a very good question, and number of things happens. So I'll say one by one. It can cause you insomnia. It can cause your mood changes. It can cause your intellectual or cognitive dysfunction. It can cause you forgetfulness. It can make you irritable. So these are your neurological factors. It can cause stroke, that means paralysis. As I said, you the risk is more than 7 times. That is your brain-related thing. It can cause heart attack. It can cause heart-related diseases, and the risk of MI increases by 4 to 5 times. So this is your heart-related thing. It can cause high blood pressure, or if you are already having blood pressure, the number of medicines which you need to take, they will be increased. So that is uncontrolled hypertension or chronic hypertension. So that is another cause of obstructive sleep apnea. It can cause weakness in your heart. So this is relating your heart. It can cause increase in your cholesterol levels. It can cause dyslipidemia in you. So that is with your cholesterol. It can cause your mood or behavioral changes. In adults, it can even cause erectile dysfunction. It can cause nocturia, means frequent micturition or increased urine in your nights. So many people don't understand for erectile dysfunction. Also, OSA is untreated. OSA is also one of the contributor. So that is one thing which can be seen. It can decrease oxygenation levels to your blood, which has impact on all the cells in your body. It can cause kidney conditions. So these are few things which can be seen because of sleep apnea. And but it's not like everyone will have all of these things. Unfortunately, we don't know who which symptoms will be seen in which patient. In few people, one or two symptoms can be seen. In few people, all the symptoms can be seen. So these are few conditions which we see if sleep apnea is left untreated. Yes, severe PAH. In the evaluation of PAH, obstructive sleep apnea is also one of the factor, or it can also cause severe PAH. So, as you said, you have severe PAH. That is another subject. For PAH, we classify it. We differentiate it. What is the cause for your PAH? So we have a cardiogenic cause, we have a cause because of the lungs, we have idiopathic cause, we have cause because of chronic thrombopulmonary embolism. So we classify you're in which category. So basing on your category, we have to address the underlying condition. Again, it's a different subject, and it's a uh, big subject. So I think that we have to discuss it personally, basing on why you have PAH. If the reason for your pulmonary arterial hypertension is obstructive sleep apnea, then just treat the obstructive sleep apnea. Then you are peace. Some amount of reversibility can be seen your pulmonary arterial hypertension. But we should understand the cause, underlying cause for your PH, then only we can address it. How to tell the difference between snoring? It's a good question. Snoring is just a sound. Obstructive sleep apnea is the disease or underlying pathology which we have it. So all the people who snore may not have sleep apneas, but generally people who have sleep apneas, they do snore. Even the vice versa is not like all the people who don't snore, they don't have sleep apnea. That's also not true. Okay, so as I said, you if the person snores a lot, look at the stop bang questionnaire, STOPBANG. So 1 point for each. Snoring, S. Tiredness, T. Observed apneas, O. P means blood pressure. Are they hypertensive or not? So 4 points. And then B, BMI more than 35, A, age factor more than 50, N, neck 17 inches, and G, gender, male gender. So again 4 points. So out of 8, if your score is less than 2, no need to worry. It's simple snoring. If your score is 4 to 8, anywhere moderate to severe risk, then you get a sleep study done. Sleep study helps us to know whether you are having sleep apnea or not. You get a sleep study. If you don't have a sleep apnea, then it's just a simple snoring for you. It is as simple as such. Reason for pulmonary arterial hypertension is ASD, VSD, atrial septal defect, and ventricular septal defect. Whole, I think, yeah, that's a good question, Doctor. Rahul. So, so it's because of the cardiac issue. I think this is not the correct place where we can discuss it. We need to see ASD and VSD. When was it? When did it? What is the sizes of those things, and when was it closed, and what effects already had it on your lungs and your pulmonary arteries before it was closed? So multiple things will be there. I think the cardiologist will say you better regarding this pH for ASD and VSD. We can discuss it later. This may not be the correct platform. Will my snoring ever completely go away? May not be. Snoring, I think, right now uh, there are some devices which helps us to prevent snoring, but if it's because of obstructive sleep apnea, you treat the underlying disease, your snoring will go away completely. If it's just simple snoring, yes, we have some devices with which we can give a try, but nothing is 100% thing, then we have to leave it as such. We should accept it and we have to go ahead. If that's not taking a toll of our health, I think there's no need to worry regarding simple snoring. Snoring treatment, there's nothing like snoring treatment. We have to see the underlying condition. What is the reason for your snoring? If it's an OSA, treat the OSA, then snoring will go. Or we try with this some medical devices. If it's gone, it's gone. If it's not going, just leave it. If it's a simple snoring, no need to worry at all. Rahul, I think you're in the wrong platform. Eisenmenger syndrome. Please suggest us to. I think this is just obstructive sleep apnea. I think that's again a different Eisenmenger syndrome. I can understand it. We can discuss about it later or in person or better with cardiologist. So, any more questions? Any more pop-ups? Or thank you.